You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The Answer Page podcast is an educational resource that produces the highest quality accredited cannabis content for pharmacists, doctors, nurses, and all healthcare providers and caregivers. Founders Stephen B. Korn, MD, and Meredith Fisher-Korn, MD, discuss relevant and cutting-edge topics focused on pain medicine, opioid use, the endocannabinoid system, and cannabinoid-based medicine for healthcare providers, caregivers, patients, and those interested in cannabinoid science. This is the Answer Page podcast.
CBD is a hot topic. Some patients may be interested in CBD products to determine if it would help alleviate one or more of their ailments, or simply enhance their overall quality of life. These patients may have questions about the therapeutic use of CBD, as well as how to judge the quality of commercial CBD products. This podcast will provide pharmacists and other healthcare providers with relevant peer-reviewed information to assist in the guidance of their patients.
Hey, welcome back. This is the Answer Page podcast. TheAnswerPage.com is a medical education resource founded by Dr. Stephen Korn and Dr. Meredith Fisher-Korn. They've been providing the highest quality of accredited education to healthcare communities for over 2 decades. We are so pleased to have them as part of the Pharmacy Podcast Network. They've been awarded in the U.S. and internationally. The Answer Page is now a recognized leader for providing multi-accredited comprehensive education on the endocannabinoid system and medical cannabis, pain medicine, and opioid prescribing practices. Stephen and Meredith, it's great to see you again.
Thank you.
Thanks so much. Thanks for always having us. It's always a pleasure to be on the Pharmacy Podcast Network. So today we thought we would present a cannabidiol primer for healthcare providers with a focus that should be really relevant for pharmacists. To begin, some patients may be interested in trying a CBD product to determine if it would help alleviate one or more of their ailments, or simply enhance their overall quality of life. These patients may have questions about the therapeutic use of CBD, as well as how to judge the quality of commercial CBD products. Some patients are reluctant to ask their healthcare providers, and many healthcare providers are not familiar with cannabinoid-based therapeutics because they never received formal education on the topic during their training. Today, we will address these relevant issues and provide access to theanswerpage.com free educational peer-reviewed resources, as well as discounts to our multi-accredited courses. For any of our multi-accredited courses, simply use discount code PPN10, think Pharmacy Podcast Network 10, for any of theanswerpage.com course and receive a 10% discount. The handouts I want to call your attention to, which I think are really relevant, they're free educational handouts. Anyone can get them. You can use them for your own learning. They're also really good to share with patients and explain things. The first is the endocannabinoid system and medical marijuana in 15 minutes. It really takes someone who knows very little to nothing about this and brings them really up to speed very, very quickly. It's really, I'm really proud of this and think it's a great resource. The other, which may be particularly relevant to pharmacists, is our perioperative considerations for products for patients utilizing cannabinoid-based medicines and products. It goes through drug-drug interactions. It lists interactions with anesthetic drugs and explains things that are really relevant for the perioperative period, including the postoperative period in terms of pain control. And then we have a primer, a cannabidiol primer, essential information for healthcare providers and consumers. A lot of that information will parallel what we're discussing today, but it's a great resource to share with patients and other colleagues. So in terms of use of CBD products, so Dr. Fisher-Korn, is there any guidance related to the quality standards of CBD products purchased online, in a retail store, at a doctor's office? It's really important that patients know what they're getting. So what criteria should a patient use when selecting a CBD product?
Oh, that's a great question. We get that a lot. So according to the Clinician's Guide to Cannabidiol and Hemp Oils that was published in an edition of the Mayo Clinic Proceedings, one should follow certain steps. For example, you have to determine if the product has been extracted by carbon dioxide with no solvents. You also need to determine if it's certified by the U.S. Department of Agriculture as organic. And you also have to confirm that it's been tested for pesticides and herbicides. The Mayo Clinic and other healthcare establishments have requirements for collaboration with manufacturers of dietary supplements. And the basis of some of these standards can be applied to the purchase of CBD products. The standards include some of the following points. Does it meet the standards of current good manufacturing practices certification from the U.S. Food and Drug Administration, from the European Union, from the Australian Union, or from the Canadian Organic Certification? And also, you need to determine, does the company have an independent adverse event reporting program? The fact that it's an independent adverse event reporting program is very important. You also need to determine, is the product certified organic or eco-farmed? And finally, have their products been laboratory tested by batch to confirm THC levels are less than 0.3%, and the product contains no pesticides or heavy metals?
I've seen on labels a certificate of analysis. So how does an individual find out if there are pesticides or heavy metals in any of the CBD products that are out there?
It's a great question. CBD manufacturers may provide a certificate of analysis. Dr. Fisher-Korn, what is a certificate of analysis? Since Todd brings this up, it's a great time to get into this. And what information is typically included on a certificate of analysis?
Okay, so the certificate of analysis is basically like a lab report, and it should be performed by an accredited, independent, third-party laboratory, and it should provide a detailed analysis of the CBD product. A certificate of analysis, often referred to as a COA, is essential to verifying the purity and the potency of a product. For example, a COA reports the amount of CBD in the product, and the amount is often described in milligrams per ml or milligrams per gram. It should also, on the certificate of analysis, it should also indicate the amount of THC, if there is any, and the other cannabinoids in the product. The presence of excipients should be indicated, the presence of microbials, including salmonella, and also the presence of pesticides. And the COA should indicate if there are molds or yeast or mycotoxins produced by the mold. And also if heavy metals are present, including arsenic, cadmium, lead, and mercury. And if there's presence of solvents, potency, and impurity content data should also be listed, and an expiration date should be listed, and the testing methods. A lot goes into a certificate of analysis.
Now, you're right. That's a lot of information, and that's a lot of detailed information. You would hope it's based on formal testing. How do you know if the certificate of analysis is real? How do you know if it's valid?
Oh, another great question. One way to establish the authenticity of a certificate of analysis is to contact the issuing lab. If an accredited lab is not listed on the COA, then the COA is not valid. Also, the CBD manufacturer should not be conducting the analysis of the product and should have no influence on the results of the report.
So it's a great report, an important report. We know now how to sort of validate it. But where do you find it?
Yeah. A COA can often be obtained by scanning the QR code on the packaging of the product or, from the manufacturer's website.
Okay, good. That really helps a lot. Okay. CBD oil products, I know, may be sold as full spectrum, broad spectrum, CBD isolate, and whole plant CBD. A lot of words. What is the difference among the four types?
That's another popular question. So full spectrum is exactly what it says. It's full spectrum. Full spectrum CBD extracts contain CBD as well as other cannabinoids, including up to 0.3% THC, also terpenes and essential oils. Unlike full spectrum CBD, broad spectrum CBD does not contain THC, but it does contain the other components that are found in full spectrum CBD. And CBD isolate is exactly what it says. It's an isolate. It's typically sold as 99% plus pure CBD. And then you also asked about whole plant CBD. Whole plant CBD is similar to full spectrum CBD as it contains a variety of the cannabinoids, the terpenes, and the essential oils. However, whole plant CBD also contains fats, waxes, and other fibrous materials.
That's a great way of breaking it down. Are CBD products that are purchased online labeled accurately? Now, how would one know?
Yeah, sometimes they're labeled accurately and sometimes they're not. So in 2017, a study evaluating the accuracy of the labels of CBD extracts that had been purchased online was performed. The study looked at the CBD content and other cannabinoid content of 84 CBD products, and they were manufactured by 31 different U.S. companies. In approximately 43% of the products, the CBD content was underreported. And in 26% of the products, the CBD content was overreported. And in 31% of the products, the CBD content was accurately reported. But of note, THC was detected in about a fifth, in 21% of the samples, but the labels didn't indicate that THC was in the product. And furthermore, the amount of THC in the products could potentially cause intoxication or impairment.
That's very important because that can affect patients in many different ways, in the workplace, at home, in terms of functioning. That's really incredibly important to know.
Yes, I agree.
Absolutely. We hear a lot of feedback from our pharmacists out there and pharmacy owners, for that matter, where they'll have patients come in and have moved their prescriptions and moved their business from one organization, one pharmacy to another, and have brought up, hey, my employer tests for marijuana or cannabis in my system. And if you're taking a CBD product, you have to be rest assured that there isn't going to be any THC in it, especially for those issues of testing. And I want to kind of ask another question that I was thinking as you were talking, and that is, what are the common reasons why patients are trailing or buying or using CBD?
So consumers use CBD in various forms, whether it's topical, gummies, or tinctures. And for topical use, consumers primarily use CBD to manage pain, whether it's joint stiffness, tendinitis, or muscle soreness, or they could be using it for dermatological conditions such as acne, dermatitis, and eczema. But these products are sometimes used for cosmetic purposes too, for example, anti-aging. And then some patients use CBD gummies or tinctures, and they'll use it for anxiety, sleep, pain, GI ailments, cognition, mood, and decreased inflammation. And some just use it for overall well-being.
Yeah, so now I have another question, which I think could be interesting. What are some of the proposed ways in which CBD may potentially help athletes feel better?
So according to some studies, the consumption of CBD may improve sleep, reduce anxiety and depression, decrease inflammation, reduce muscle pain and soreness, and enhance recovery. So there have been several articles that athletes are trying CBD to help improve their performance.
We've really been thirsty for this kind of information on the Pharmacy Podcast Network. Pharmacists are listening. Pharmacy technicians are listening. Pharmacy business people are listening. So with the pharmacists in particular, shout out to you. You guys are my favorite providers. Let's talk about the clinical considerations. I definitely want to hone in on that.
Okay, so I think we should start off with a very significant issue, which is respiratory depression and respiratory arrest. Dr. Fisher-Korn and I have created a lot of content on the opioid epidemic, concerns about the primary issue with that, which is respiratory arrest. We know opioids and benzodiazepines may lead to respiratory depression. So, Dr. Fisher-Korn, does CBD lead to respiratory depression?
So the consumption of CBD has not been associated with respiratory depression because it doesn't bind to the cells in the respiratory center of our brains. However, the quality and purity of CBD products can vary widely, as we discussed earlier, and contaminants and or mislabeling could then introduce risks, including respiratory depression.
Yeah. So the important point is, CBD in and of itself is not going to cause respiratory depression by not binding to the respiratory center, but you got to make sure you have a quality product so that it doesn't have contaminants that could cause adverse events beyond the beyond your expectations for the CBD. So opioids and benzodiazepines can be addictive. Is CBD addictive? Does the abrupt discontinuation of CBD use lead to withdrawal symptoms?
So in 2020, a study evaluating abuse liability of CBD found that CBD is not addictive, and the abrupt withdrawal of CBD after 4 weeks of use at 750 milligrams twice daily, taken orally, and that's a high dose, did not result in any symptoms of physical withdrawal. But for individuals who have a seizure disorder and are using CBD to control the seizures, the CBD product should not be abruptly discontinued. Similar to other seizure medications, the CBD should be tapered. And also, you need to keep in mind that CBD does interact with many of the commonly prescribed seizure medications. So as the CBD is tapered, the levels of the other seizure medications need to be monitored.
So when teaching our residents, when teaching other colleagues, when instructing patients, we try to be exact in our terminology, and that doesn't always occur in medicine. The words are used properly. So it's often stated that CBD is not psychoactive. You hear that all the time, and THC is psychoactive. But Dr. Fisher-Korn, would you say that's an accurate statement? Is CBD psychoactive?
Actually, both THC and CBD are psychoactive. By definition, a psychoactive drug is a substance that acts on the central nervous system where it alters brain function and neurotransmitter function, resulting in temporary changes in perception, mood, consciousness, and behavior. But unlike THC, CBD does not induce that euphoric feeling, the high that you get from consuming THC, and CBD does not induce hallucinations. But as we've discussed earlier, CBD does help with sleep and overall mood. So yes, CBD is psychoactive.
Very important distinction. Does ingesting CBD with lipids, different meals, lipids, impact the absorption of CBD?
Surprisingly, yes, and it's significant. According to clinical studies evaluating the metabolism of a CBD product, consuming CBD with lipids may enhance the absorption of CBD and increase CBD levels by up to 4 to 5 times.
That's significant. That's very significant.
Yes.
And also for our pharmacists, how is cannabidiol metabolized?
Well, most of our information about CBD metabolism comes from the FDA-approved product called Epidiolex, which is an anti-seizure medication. And what they found in those trials is that CBD is extensively metabolized in the liver by the cytochrome P450 enzymes, CYP3A4 and CYP2C19. CBD metabolites are excreted in feces and in urine, and CBD has a high volume of distribution, and similar to THC, CBD is lipophilic and accumulates in adipose tissues.
Just for our listeners' sake as well, back to the lipids and digestion. And so you had made the comment that if you're eating something specific and taking CBD at the same time, it will enhance the impact of CBD. So is that fatty food? Is that sugar? Like what food would we eat on purpose with a CBD in order to get the maximum value out of it?
Well, lipids are fats. So it's the fatty foods, it's the French fries, it's the fatty oil foods.
Yeah. And it's also that one may not want to necessarily do that to get a quick absorption. I mean, you want to get on a regime that you're comfortable with and then sort of keep that and then slowly modify it. So we're not recommending that someone just immediately take CBD with a fatty meal to get a quick uptake and distribution. You really want to get on the regime, get comfortable with it, and then alter it. It was more to point out that this can significantly change the absorption of CBD.
Excellent point, Dr. Korn.
Excellent.
Okay, so now let's switch to some info on drug-drug interactions as we get near the end of this podcast. So one of the courses that I'll say Meredith, Dr. Fisher-Korn, had written for theanswerpage.com is called CBD in Clinical Care. I know that you reviewed drug-drug interactions in detail in that course. For example, there's a discussion on drug-drug interactions between CBD and enzyme substrates, inhibitors, inducers of CYP3A4 and CYP2C19. We're not going to have the opportunity to review them in this short podcast. They are in the course, but there are especially some noteworthy drug-drug interactions I'd like to hit on today. So can you discuss a few?
Sure. There's actually 3 that I'd like to highlight. The first one is CBD and warfarin. CBD's inhibition of CYP2C19 can increase levels of warfarin, and multiple reports have indicated that the interaction between warfarin and CBD results in a greatly increased risk of bleeding. The second one that I wanted to highlight is CBD and methadone. CBD inhibits CYP3A4 as well as CYP2C19, and both of these enzymes are involved in metabolism of methadone. So the co-administration of methadone and CBD can lead to significant sedation, and there have been multiple case reports where patients are taking CBD without telling their doctors, and then the doctors prescribe methadone, and the patients end up being significantly more sedated than expected. So the third drug-drug interaction that I wanted to mention is CBD and anti-epileptic drugs. The co-administration of CBD and anti-seizure medications is associated with significant increases in serum levels of several seizure medications, and the dosages of the seizure medications may need to be adjusted when either you initiate the CBD therapy or even if you just change the dose of the CBD therapy.
All right. This was really interesting, packed with a lot of great information. A shout out to our listeners. In the show notes, we are going to have a link to the course that Dr. Meredith Fisher-Korn mentioned, the drug-drug interactions course. We really want our pharmacists to tap into that. And once again, use code PPN10 to get 10% off of your course that you purchase through the Answer Page. Once again, it's theanswerpage.com. Meredith and Stephen, this has been wonderful to have you back on the Pharmacy Podcast Network, guiding our providers, our pharmacists out there with the best leverage and usage of CBD and THC. We can't wait to have you back.
Thanks very much. It's always a pleasure to be on the Pharmacy Podcast Network. Thanks very much.
Take care. Thank you.